take your blood pressure pill every morning, just like your doctor told you, but the numbers still rise and fall, unpredictably. Here's something many people never hear. After age 65, the time you take your medication can matter almost as much as the medication itself. Because as we get older, our blood pressure rhythm changes. Some people have a sharp morning surge right after waking. Others have blood pressure that stays too high at night while sleeping. That's why some doctors adjust not just what you take, but when you take it, splitting certain medications into a morning dose and a nighttime dose to help stabilize blood pressure across the full 24 hours.
By the end of this video, you will understand why blood pressure timing matters more after age 65. You will see what happens inside the body that causes numbers to rise in the morning or stay high at night. You will learn which medicines doctors may split into a morning dose and a night dose. You will also learn who should avoid this approach and how to check blood pressure at home in a way that keeps you safe. Before we go further, a quick reminder. This video is educational. It does not replace medical care. Do not split pills. Do not change the time you take your medication, and do not stop a medication on your own. Work with your doctor to decide what is right for you. Every person is different. What helps one person may not help another. Now, let's look at how blood pressure normally changes over a full day, and why these changes become more noticeable as we age. Blood pressure is not a constant number. It follows a day and night rhythm, controlled by the body's internal clock. When we are young, that rhythm is usually smooth. Blood pressure drops at night while we sleep, and rises again in the morning as we wake up. As we pass 65, this pattern can change. Some people experience a strong morning surge. Blood pressure jumps quickly in the first few hours after getting out of bed. Others develop nocturnal hypertension, which means their blood pressure stays too high while they are asleep. And many older adults become what doctors call non-dippers. Their blood pressure does not fall at least 10% at night like it should. Why does this happen more with age? Arteries become stiffer. The autonomic nervous system becomes less flexible and reacts more slowly. Medical conditions that are more common in older adults, like diabetes or kidney disease, also interfere with the body's ability to regulate blood pressure. These changes can make blood pressure swing higher at the very times when the heart and brain are most vulnerable. That is one reason strokes and heart attacks happen more often in the morning. If you often see your highest numbers right after waking up, or if your doctor has mentioned high readings at night, the next part of this video is especially for you. Let's talk about why some doctors adjust not only what medication you take, but also when you take it, to help keep blood pressure steadier across 24 hours. Blood pressure medicines do not work all day the same way. Every drug has a start point, a peak effect, and a point where the effect begins to wear off. For many years, taking one dose in the morning has been the usual routine. It is simple, and for many people, it works well. But after 65, when blood pressure becomes less predictable, one single morning dose may not fully protect the times when blood pressure rises the most. If the effect fades in the evening or during sleep, the numbers may creep up again. If the effect peaks too strongly during the day, you may feel lightheaded when you stand up or walk. So some doctors adjust the schedule. They may keep part of the medicine in the morning to protect the daytime hours when you are active. Then they may shift part of the dose to the evening so there is more protection during sleep and during that early morning surge. The idea is simple. Match the medicine to the pattern of your blood pressure. Keep the coverage steady. Avoid sharp highs and sharp lows. A smoother 24-hour curve can lower strain on arteries and vital organs. This is not a one-size-fits-all approach. It does not apply to every medicine, and it does not replace the need for careful monitoring. But for some older adults,
especially those with high nighttime numbers or a strong morning rise. This adjustment can make their blood pressure more stable. If you are wondering which medications might be considered for morning and night dosing, the next part will explain that clearly. And just as clearly, who should not try it. Not all blood pressure medicines are the same. Some last longer, some peak quickly, some can cause side effects that depend on the time of day. That is why doctors look closely at each medicine before deciding whether to adjust the schedule. Medicines like ACE inhibitors and ARBs are often the ones doctors review first. Examples include lisinopril and Losartan. These medicines help relax blood vessels. They protect the heart and kidneys. Most of them last long enough for once-daily use. But if home or ambulatory monitoring shows a strong morning surge or high numbers at night, the dose may be divided into morning and evening. The decision depends on the specific medication, the dose, kidney function, and how stable the patient is. Calcium channel blockers, such as Amlodipine, usually stay once daily. They have a long duration of action and tend to keep blood pressure controlled across the day. They rarely need to be split unless a doctor finds a specific reason to do so. Thiazide diuretics, such as hydrochlorothiazide, are different. They help the body remove extra salt and water. They are almost always taken in the morning. Taking them at night can lead to frequent trips to the bathroom and disrupt sleep. For most older adults, keeping diuretics in the morning is safer. Beta blockers are a special case. They are often prescribed for heart rhythm problems or after a heart attack. Some have shorter duration and may be taken twice a day. But a nighttime dose may slow the heart too much in some patients, especially those with sleep apnea or symptoms of dizziness. Doctors weigh these factors very carefully. It is important to say this clearly. If your pill is extended release, controlled release, or has a special coating to release the medicine slowly, it should not be cut, split, or taken at a different time without professional guidance. The same is true for combination pills that include more than one medication. The schedule must match the design of the pill. Taking a medicine at the wrong time can be just as risky as taking the wrong dose. That is why changes in timing require medical supervision and, in many cases, more frequent blood pressure checks at home. Now that we have talked about the medicines themselves, let's look at the patients. Who might benefit from split dosing and who should avoid it? Split dosing is not about taking more medicine. It is about placing the right amount at the right time. But it is not the best approach for everyone. Some older adults may do well with this strategy. For example, people whose home or ambulatory blood pressure monitoring shows a strong morning surge may benefit when part of their medicine is moved closer to nighttime. People who have high readings during sleep may also see better control with a dose before bed. There are others who feel dizzy or lightheaded during the day because their medication peaks too quickly in the morning. Adjusting the timing may reduce those daytime symptoms. Chronic kidney disease or diabetes can also change how the body regulates blood pressure across 24 hours. These conditions sometimes make nighttime numbers harder to control. In those cases, doctors may consider shifting part of the dose to the evening, but only with close monitoring. On the other side, there are situations where split dosing is not a good idea. Frail older adults are a key example. Studies have not shown benefit for them with nighttime dosing, and any drop in blood pressure at night can increase the risk of falls when getting up to use the bathroom. People who already have dizziness when standing, who have a history of fainting, or who are at high risk of falls need extreme caution with any change in medication timing. Advanced kidney problems can also make timing changes more risky. If the medication remains in the body longer, an evening dose may cause too much lowering at night. People who have slow heart rates or rhythm problems, especially if they take beta blockers, also need careful supervision to avoid symptoms during sleep. There is another simple, practical concern. If someone already has trouble remembering their medicine, splitting the dose into 2 times a day can make things worse. Missing doses can lead to more dangerous swings than taking the pill once a day. The bottom line is this: split dosing can help the right person, but it can create problems in the wrong person, and only careful measurement can tell the difference. If you and your doctor ever consider adjusting the schedule of your medication, you will need a safe plan to track your blood pressure at home. The next part of this video will show you exactly how to do that. If you and your doctor are trying to smooth out your blood pressure across the full day, home monitoring becomes the most important tool. You do not need to measure all the time. You only need to measure correctly. Always sit quietly for at least 5 minutes before checking. Place both feet flat on the floor. Rest your arm at heart level. Try to relax your breathing. Do not talk while the cuff inflates. Give your body a moment to settle before you look at the numbers. There are 2 ideal times to measure. One is in the morning, within the first hour after you wake up, but before you take your medication, before coffee, and before breakfast. The second is in the evening, before going to bed. Each time you measure, take 2 readings, about 1 minute apart, and write down the average. Your doctor will usually want 3 to 7 days of results. That pattern helps show whether timing adjustments are working. If the morning numbers start to come down smoothly, or if the night numbers are no longer rising, that is useful information. If the numbers drop too low, that is just as important to know. There are signs that should never be ignored. If your blood pressure is very low, with symptoms like dizziness, trouble walking, or feeling faint, you should contact your healthcare team. If the numbers go extremely high, especially with chest pain, shortness of breath, or sudden changes in speech or vision, that is an emergency. The goal is not to chase every reading. The goal is to understand the pattern. When the pattern is clear, your doctor can decide whether your medicine should stay the same or whether part of the dose should move to a different time. Once you understand how to measure the right way, the next question many people ask is how the schedule might actually look in real life. The next part will give a few simple examples. These are not recommendations, but they can help you picture how your doctor might think through a timing change. Let's look at how this might work in real life. These are only examples to help you understand the idea. They are not personal medical advice. Imagine a person whose blood pressure is highest in the first hours of the day. Their doctor may keep part of the medicine in the morning to protect daytime activity. Then the doctor may move another portion of the dose to the evening. The goal is to limit that sharp rise after waking. Now imagine a different pattern. Someone whose blood pressure stays high during sleep or late in the evening. Their doctor may shift part of an ACE inhibitor or an ARB toward bedtime, but the diuretic, if they take one, usually stays in the morning to prevent frequent urination at night. There are also cases where someone feels dizzy or unsteady during the day, especially after taking a full dose in the morning. Their doctor may reduce the morning amount and move the rest to the evening. That way, the person is less likely to feel lightheaded when they get out of a chair and begin moving around. These examples are simple. Real decisions take more into account. Kidney function, heart rhythm, sleep quality, safety when getting up at night, and how well someone remembers their medication all matter. Proper timing is not a magic fix. It is a fine adjustment. It is most helpful when blood pressure patterns are clear and when the doctor has a way to monitor the results. If a timing change is made, the doctor will usually ask for regular home readings over 1 or 2 weeks. Then the plan may be adjusted again. In the next part, we will answer some common questions people have when they hear about split dosing for the first time.
People often ask whether split dosing is safer than taking everything in the morning. The answer is that it depends. For some people, spreading the dose can keep their numbers steadier. For others, there is no benefit. It must be decided case by case. Another common question is whether someone can split a pill on their own. The answer to that is no. Not all tablets are designed to be divided. Some release the medication slowly over the day. Others have coatings that protect the stomach. Changing how they are taken can create serious problems. A doctor or pharmacist must tell you if a pill can be split safely. People also ask how long it takes to notice any change. Most of the time it is not instant. It may take 1 to 4 weeks of careful home monitoring to see a real pattern. And sometimes the plan needs to be adjusted more than once. Finally, people wonder if taking blood pressure medication at night will make it too low while sleeping. That is a valid concern. It can happen in some individuals. That is why the decision must be made with proper testing and follow-up. Safety always comes first. Understanding these questions helps you talk more confidently with your healthcare team, and it helps you recognize that timing is a tool, not a shortcut. In the final part, we will review the key points and guide you to the next helpful videos on this channel. Let's take a moment to review what we covered. After age 65, blood pressure often becomes less predictable. It may surge in the morning or stay high at night. For some people, adjusting when they take their medication can help smooth out those changes. But it has to be done carefully. It requires home monitoring, and it must be guided by a healthcare professional who understands your full medical history. If your numbers rise at risky times of day, your doctor may consider split dosing for certain medicines. Other medicines should remain exactly where they are. Some should never be split. Safety comes first. The most important thing you can do is measure correctly and keep track of your readings. Patterns in those readings help your doctor make the best decisions for you. If you want to continue learning, the next helpful step is to watch our video on morning versus night dosing for Losartan. And you can also learn about the key side effects of amlodipine that older adults should not ignore. Thank you for watching MedDose Explained. Stay informed, stay safe, and always work closely with your healthcare team.